She was supposed to save them. She was trained to protect the weakest lives on Earth. Instead, babies stopped breathing. Hearts slowed. Alarms screamed again and again. Doctors were confused. Parents were broken, and one nurse was always there, calm, quiet, watching. She wasn't a monster hiding in the dark. She wore scrubs. She carried syringes, and she smiled softly while children died. Her name was Genene Jones, a nurse who shocked the world by turning a place of healing into a chamber of death. Genene Ann Jones was born in 1950 in Texas, USA. Her childhood was marked by instability, illness, and emotional neglect. After losing her mother at a young age, Genene developed an intense need for attention and control. Nursing seemed like the perfect profession, respected, trusted, and powerful. By the late 1970s, she became a licensed vocational nurse, specializing in pediatric care. To coworkers, she appeared dedicated. To parents, she seemed caring. But beneath the image of a compassionate nurse was a dangerous desire to be the center of every crisis. Genene Jones worked at Bexar County Hospital in San Antonio. Almost immediately, doctors noticed something disturbing. Children under her care suffered unexplained medical emergencies, seizures, respiratory failure, cardiac arrest. Strangely, these incidents often happened when Genene was on duty. Even more disturbing, she frequently saved the child afterward, appearing heroic. Colleagues began whispering, was it coincidence? Or was someone creating the emergencies? Investigators later believed Genene Jones deliberately injected children with succinylcholine, a drug that paralyzes muscles and stops breathing, or overdosed them with heparin, causing internal bleeding. Some children survived. Many did not. Estimates suggest dozens of infants and children were harmed, and possibly up to 60 deaths may be connected to her. Parents trusted the hospital. They trusted the nurse, and that trust was weaponized against the most innocent victims imaginable. Rather than stopping her, the hospital quietly allowed Genene Jones to resign, fearing lawsuits and public scandal. This decision proved catastrophic. She moved to a private pediatric clinic in Kerrville, Texas. There, without the oversight of a major hospital, the deaths continued. Babies collapsed. Emergency calls increased. One child, Chelsea McClellan, died suddenly after an injection by Genene. This time there would be no cover-up. Authorities finally stepped in. Medical records were reviewed. Patterns were undeniable. Toxicology reports revealed lethal drug levels inconsistent with medical treatment. In 1984, Genene Jones was arrested. Prosecutors faced a grim challenge. Many bodies had been cremated, evidence destroyed, records altered. Still, the surviving cases painted a horrifying picture of a nurse who thrived on chaos, attention, and control over life and death. Experts described Genene Jones as suffering from Munchausen syndrome by proxy-like behavior, where caregivers harm patients to gain sympathy and praise. She enjoyed being the hero nurse, reviving children she had nearly killed. Unlike crimes driven by money or rage, Genene's motive was darker emotional gratification. She wanted to be needed. She wanted to be admired. And she was willing to kill to achieve it. In 1985, Genene Jones was convicted of murdering Chelsea McClellan and sentenced to 99 years in prison. Later, she received an additional 60-year sentence for attempted murder. Due to legal technicalities and destroyed evidence, many suspected victims never received justice. Families were left with grief and the unbearable knowledge that their children died at the hands of someone they trusted completely. Decades later, Genene Jones remained a symbol of institutional failure. Hospitals prioritized reputation over lives. Warning signs were ignored. In 2017, she was indicted again for another child's murder, but legal delays and health issues complicated justice. Her case sparked major reforms in hospital reporting systems and nurse monitoring across the United States. Genene Jones didn't break into homes. She didn't chase victims. She waited beside hospital beds. Her story is a nightmare reminder that evil doesn't always look dangerous. Sometimes it wears a name badge and stands right next to us when we are at our most vulnerable.